So what we're talking about are actually three different words. Guilt is part of the criteria for depression in bipolar type 2. Another word is shame. And a third word that I will explain is disgust. Disgust. But in the Townsend book, and this is in the chapter about cognitive therapy, which I didn't really include as a required reading chapter, but we will talk about it today because the leading treatment for depression and the leading treatment for anxiety is what's called cognitive behavioral therapy, CBT, cognitive behavioral therapy. So in the cognitive therapy chapter of your book, which is, this is found on page 330, she talks about a schema. And a schema is a person's fundamental beliefs and assumptions, sort of their primal paradigm or worldview, how they view themselves. And if I kind of drew a little brain up here, I don't know if you can tell, this is a brain, that's a brain stem. And automatic negative thoughts or thinking, anything that requires words, is taking place at the top of the human brain, where we have our language capabilities. It's really the left prefrontal cortex. At a deeper level, sort of the part of the brain that we share with other mammals, is where a lot of schemas, we think that's more where the schema originates, because a lot of this is pre-verbal, like emotions that we have trouble putting a name to, but they still affect how we live our life, and they affect our behavior. So these deeper cognitive structures are called schemas. And Townsend in the book says the two most common schemas, the most common one is actually called unlovability, and then helplessness, the very common schema. And that's table 19-1 in the book on page 331. So in the DSM, they use the word under bipolar type 2, worthlessness, feelings of worthlessness. And to me, that's essentially the same thing as unlovability. Basically, different researchers using different words to mean essentially the same thing. Or excessive or inappropriate guilt, which may be delusional. So what's the difference between guilt and shame? Guilt and shame. And I have a second page to this, but basically guilt seems to be a transitory state where you did something bad, you lashed out at a loved one, said some mean things, and you feel guilty. And then you apologize, and the feeling goes away. Maybe they accept your apology. So guilt is not a reflection on your very internal core of who you are, but shame is. Shame is a permanent state, what we would call a schema. I bought these Post-it pads specifically so I could rip these off. It's very satisfactory. I highly recommend it. That Post-it pad. You do the rip. Anyway. So with the current pandemic, I've been diving into the immune system, trying to understand the immune system a lot more. And I stumbled across a part of the immune system, and I honestly had never really heard of this before, but it's called the behavioral immune system. The behavioral immune system. And this is the part of the immune system that guides and changes how we act and how we behave. And of course, it's all happening at a very non-conscious level. But a part of the behavioral immune system is this word, disgust. And this is a very primal, what we would call a basic emotion. And the word primal to me means we've identified disgust in all kinds of animals, not just humans. Other animals are disgusted by things. And it's cross-cultural. It seems to be occurring in the brain. Aversion occurs at D3 in the nucleus accumbens. I just think that's interesting because cocaine hits on D2. And so cocaine is, makes you happy, and disgust causes aversion. Weird. But the biggest thing with disgust is it encourages disease avoidance. And so if you are walking along the street and you see a dead animal and it's all rotten and gross and there's maggots coming out and you're disgusted, you will turn away. And it's pretty universal. There's things that disgust us, and it's part of our immune system. And the interesting thing about our vision, our eyesight, is that if we see something disgusting, our white blood cells start pumping out an inflammatory cytokine called IL-6, interleukin 6. So even before we are exposed to disease, this is all happening in the brain. Even before we're exposed to it, our immune system is getting all revved up. Interleukin 6 is interesting because that's the center of a ton of research with the coronavirus. So those white blood cells, they get angry, they start secreting these little chemicals that do all kinds of things, but one thing IL-6 does is it starts eating lung tissue. And so if we think of a COVID patient who then goes into ARDS, what's really happening is those white blood cells are angry in the lung. So that also happens with this emotion, disgust. I've been thinking about disgust this weekend because I had an interesting thing happen at midnight on Saturday. We just moved into our new home, and by new, it's like 80 years old, and it's taken us about 2 months to just paint and get it cleaned up. It's a fixer-upper, but it's cool. And the problem with old homes, though, is sometimes you get bats in the house. And so midnight, Saturday night, I heard a door slam really loudly, and my daughter had gone to the bathroom, and there was a bat in the bathroom flying around. Bats are terrifying to me. I could probably put this on my list of phobias, which part of the reason is because I have a lot of certifications. I have a lot of letters after my name. I would say each letter constitutes something else I'm terrified of. And one thing I'm scared of is rabies. I've been scared of rabies since I was a kid, though. And the problem with rabies, if you get bit by a dog with rabies, you know, you have to go get your rabies shots, which I was told in grade school that that meant like 21 shots in your stomach. And I honestly did not know that this wasn't true until I was preparing for this. We actually give 5 shots, and it's the same as a influenza. It just goes right in the deltoid. I honestly didn't know that. I'm like an ER nurse. I have lots of letters after my name. And I'm confused because I have given the rabies shot to people in the ER. And in my memory, I'm like, I'm positive we gave it in the stomach, but we didn't. We gave it anyway. But one of the factoids I had to memorize for the certified emergency nurse exam is rabies. There's always at least one question about rabies on the exam. And the question usually is, in the United States, where are you going to get rabies from? In the United States, what's the most common cause of rabies? And the correct answer is bats. And the CDC guidelines, which is also a potential exam question on that exam, the CDC guidelines for when should you get a rabies, the whole rabies series, it's not when you've gotten bitten by a bat, it's when you wake up and there's a bat in your house. That's the CDC guideline. And the reason for that is that most people when they're sleeping don't know they've been bitten because their teeth are so small, bats' teeth are so small, you don't even know you've been bitten. So I know all this stuff, and I'm paralyzed when there's a bat in my bathroom at midnight on Saturday. But that basic emotion is cross-cultural. So I put a lot of cognitive thinking into that as well. But for, at its core, this is all nonverbal. There's no real words associated with it. This is the reason why if you step on a snake out in the yard, you jump back. The interesting thing about the research on the word shame, as it turns out, is the same thing. It's part of the behavioral immune system. It's basically disgust directed at yourself, back at yourself. And it's a primary basic emotion where you are the source of contamination. So in a social setting, shame is at its very primordial level, you trying to prevent the rest of the community from catching what you have. And what it looks like is the unlovability schema. Unlovability schema. And the difference between disgust and shame, and the third word, guilt, is disgust and shame both encourage social avoidance. If you are disgusted by another person, you'll stay away from them. If you are disgusted by yourself, you also stay away from other people. And the 3 populations where this has been studied the most in society are disability, disabled people, the elderly, as a kind of global society, we tend to stay away from the elderly, and morbid obesity, fat shaming seem to tie into the behavioral immune system. But what shame, so in the DSM-5, they use the word guilt, but I think it will be replaced with the word shame. Because guilt, interestingly enough, is the exact opposite. It encourages social cohesion and what they call approach behaviors. Because if you feel terribly guilty, you know that if you go to that person and apologize, they'll forgive you, everything is better. So guilt is a very temporary, short-term thing, and it's not a reflection on you as a person, whereas shame is a reflection of you as a person, and it leads to avoidance behavior. Does that make sense?